Your cat has changed litter box habits and you're concerned something is wrong. It might be bladder stones. I'm Lyndall from Vetster, and today we're discussing how to detect and treat bladder stones in cats. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's get into it.
So what actually are bladder stones? They're mineral clumps that form inside the bladder from your cat's urine. When mineral concentrations in your cat's urine get high enough, they start to crystallize and clump together over time. The two most common types are struvite stones and calcium oxalate stones. Why does that matter? Because how you treat them is completely different, and we'll get to that. A few things can push your cat toward developing them: their diet, how concentrated their urine is, the pH of their urine, and whether they've had any bladder inflammation or infections. Some cats are just more prone to them than others. If your cat has bladder stones, you might notice blood in their urine, or they're making frequent trips to the litter box but only producing a tiny amount each time. Straining to urinate, crying out, avoiding the litter box altogether, or grooming around their genitals more than usual are all signs something's off. One thing worth knowing: straining to urinate looks almost identical to straining to poop. So, a lot of owners assume their cat is constipated when it's actually a urinary issue. If you're not sure which one you're seeing, that's exactly the kind of thing a vet can help you sort out. Smaller stones can cause zero symptoms, which is why any change in litter box behavior is worth taking seriously. Your cat can't tell you something hurts. A change in routine is how they tell you. Now here's what I really want you to hear. If your cat is straining to urinate and nothing is coming out, and they're also vomiting, lethargic, or not eating, that is a veterinary emergency. Do not wait until morning. What can happen is a stone gets lodged in the urethra and creates a blockage. Male cats are more vulnerable because their urethra is longer and narrower. A full blockage can cause kidney failure within a couple of days. If you're not sure, call a vet. To diagnose stones, your vet will likely do a physical exam, urinalysis, and blood work, then use X-rays or an ultrasound to actually see what's going on. Most stones show up clearly on imaging, so once your vet gets a look, they'll know exactly what you're dealing with. Treatment depends on the stone type. Struvite stones can often be dissolved through a prescription diet, no procedure needed. Calcium oxalate stones can't be dissolved, so those need to be flushed out or surgically removed. In some cases, if the stones aren't causing symptoms and aren't progressing, your vet may recommend monitoring instead of jumping straight to treatment. It really depends on your individual cat. Cats who've had stones once are more likely to get them again, so long-term prevention usually means diet management. Your vet might recommend a therapeutic food formulated to reduce stone formation, and regular follow-ups help catch anything new before it becomes a bigger problem. Most cats with the right care do really well. If you're worried about your pet, you can book a licensed vet online at Vetster right now, day or night.